Okay, my name's Rob. 30 years ago I had a car crash, and the result of that I was in intensive care for 30 days, and broke both my legs, both arms, cracked pelvis, and a little scratch just there. When I came to after the accident, the doctors said, you know, the medication I was on, I may be kind of a bit irrational, kind of cold turkey sort of things, because the drug I was on was just below LSD apparently. And the result of that really, I went back to work, working for the bank, and carried on for 10 years thinking why I couldn't do my job. I was getting very stressed out at work, couldn't perform as well as I could do before, and discovered the fact after that I had obviously brain damage from the accident. After pressures from the bank and received from there, I had to go off work due to mental health reasons, and I was therefore medically retired from the bank because I was unable to do the work I could do before. Confidence was knocked, and I felt inadequate because I couldn't do what I was doing beforehand. I couldn't provide for my family, and I felt very much deprived. I felt I was depriving everyone. And because of that, I've got anxiety within that. And there's times when you're lying in bed and your heart with the anxiety, you have panic attacks, your heart's kind of pounding, you think, just take me, just finish it, just deal with it from there. But that's just anxiety issues from that. And then talking to people, I then discovered the fact that it is perfectly normal and natural. I was then speaking to a GP. He referred me to various organisations which do different activities such as gardening or home improvement sort of things for people, just basically giving back to people. And I felt that's very therapeutic, and also volunteering at Highwoods Country Park when I was going out there and doing some real conservation sort of work. So I feel I was really making a real impact on people and on the environment as well. And with the help and support I had from various charities such as Headway and Mind and various organisations like that, I got back into some sort of work, working for a charity to start off with, Open Road, doing people with drug and alcohol issues, doing nature recovery sort of programs. And I felt this was my vocation, giving back to people, making them feel better about themselves, as it made me feel better at the same time as well. The COVID hit, and that we couldn't do anything, couldn't go out and do anything at all. And I decided to set up this community allotment, again trying to give back to people. And it's just basically a peaceful space for people who haven't got the time necessarily to do an allotment, and haven't really got the capacity or mental capacity to be able to deal with it, and the stress involved in doing these sort of projects. And they can then benefit from it. And if they spend 5 minutes a day doing these sort of things, it's 5 minutes more than they would have done beforehand. And that 5 minutes then builds up to 10, 20, and so on there. So get more active and be more proactive themselves and improve themselves. I was basically talking to people like from the charity I work for, Open Road, which then links into other charities such as the Night Shelter, because they have a similar sort of client base. Then refer to Beacon House, Headway, Mind, and also the GP surgeries. And then people have approached me saying, "Who thought about this sort of group or that group?" And then people from the Dementia Association got in contact with me, asking what they can do. Health Watch S has got in contact with me, and it's just basically kind of talking to various different organisations which offer the support. They refer people to me, and then I can then identify from my experiences where people need to go, and hopefully help them to find their own recovery programme.